comes up this way. So when that pulls, it's going to do this. It's going to do elevation, but also it's going to participate in that downward rotation. And these are back there, you know, if you want to like grab a scapula and just hold it where things are pulling, okay? Okay, rhomboids. Okay, so rhomboids are going to be along this vertebral border. Okay, so they're going to be pulling actually in and up because they're pulling at an angle. Okay, so pulling in and up. So it's going to assist a little bit in elevation because it's pulling up, but it's also going to be pulling in and it's going to create some downward rotation. That must have cut off our air conditioning budget. Okay, so serratus anterior. So that's here on your side. So where serratus anterior is running, it like attaches on this vertebral border, but on the anterior side of that. So it's coming underneath the scapula and around to the ribs. Okay, that's what that picture's trying to show you. Is that backwards? Sort of. So if I put this up here, see it's coming out from here and around. Okay, so this is what, when you work out, it gives it that lovely little ripply effect right here.
Looks like feathers.
Huh?
Looks like feathers.
Looks like feathers, yeah, it does. So basically what we're going to get, can you see how if we're pulling this way, we're going to get abduction. So we're going to pull the scapula away from the midline. And we're actually going to pull it into a little bit of upward rotation. Are we starting to see a trend where like we've got more than one muscle that does a whole bunch of stuff, don't we? Yeah. There's not a lot that we do that we use only one muscle. All right, pectoralis minor. So that's going to be an anterior structure. So we're looking front to back now. Here's the coracoid process. Here's your glenohumeral joint. You see how shallow that glenohumeral joint is? So it's any wonder why we don't dislocate our shoulders all the time, huh?
That's why in a stroke, sublux.
That's why in a stroke you sublux, because we really depend, there's like a tiny little ligament that's in there that kind of holds that sort of kind of together. It's very easily damaged. And so we're really dependent on muscular control to maintain this. And so if you lose muscular control for some reason, as in a stroke, then this literally just falls right out of the socket. It's a weird thing to feel. Okay, so let's look at pectoralis major. So we've got an attachment here on the coracoid process down to ribs 3, 4, and 5. Okay. So if I slide that in underneath there, I'm pulling on this. Okay, so this is going to pull down. It's going to actually create a little bit of downward rotation. And it can create a little bit of abduction or protraction. So pectoralis minor is that one that's largely responsible for this lovely shoulder forward that we get that translates into protraction. So it's going to, as it's pulling, it's going to rotate a little bit and like we're using pectoralis minor to do this. Okay? So a lot of times if you have a scapula that's not